Pleasant day to all. Welcome to Be Still Training Solution here in Rodriguez Rizal, your training center, and to Caregiving NC2. Alright, I am your trainer. My name is Catherine May P. Deliege. I have prepared here 9 CBT areas, progress achievement chart, and training activity matrix. So again, welcome to Be Still and Know Training Solutions here in Rodriguez Rizal. So let's start off with an opening prayer. In Jesus' name we pray, Amen. So before anything else, I'd like to check first those who are present today. So as I call your name, please raise your hand. Maria Corazon, Jose Marie. Okay, thank you. Alright, so before we start the main orientation, we'll run through a few quick assessments. This helps us to understand your current skills, knowledge, and experience so we can tailor it to your specific needs. So we will start off with trainees characteristics, that would be 10 minutes, pre-test 20 minutes, and self-assessment checklist for 10 minutes. Okay, so let's start. Okay, so please don't worry about the results of this test. This assessment has no bearing on whether you can join the training or on your final grade. This will just serve as a gauge on determining your training content and the pace to ensure the best possible learning experience for everyone. Alright, so let me now give you a short background regarding your training center. Be Still and Know Training Solutions is newly TESDA accredited training and assessment center, which is located in Barangay San Jose Rodriguez Rizal. We offer courses such as Caregiving NC2, Emergency Medical Services NC2, and Healthcare Services NC2. Our mission is to provide high-quality training to enable our trainees to be globally competitive and easily land a job, while our vision is to have an affiliation with recruitment agencies that will help us in facilitating the deployment of our graduates. So do you have any question? None. Okay, let's proceed. So now I will be showing you the Caregiving NC2 workshop layout. So we are now here in Contextual Learning Laboratory. So let's start off with the practical work area. So where learners acquire skills through hands-on practice in various workstations. So next to that is institutional assessment area for assessing the learners' acquired competencies and skills, including recognition of prior learning. So beside that is the trainers resource area. All right, so it holds materials for instructors such as learning materials, training regulation, and curriculum exemplars. So next to that is Learning Resource Center. Provides the knowledge materials like printed multimedia for self-paced learning, often near the trainer's resource area. Okay, then Contextual Learning Laboratory provides the underpinning knowledge, science, mathematics, and communication principles applied to the trade. Okay, so the next is the Quality Control Area. Quality Control Area provides various tests. Metrology and calibration are conducted, including in process quality control. Next is Support Service Area provides value-adding competencies. Computer Laboratory for learners to acquire and develop IT competencies relevant to their qualification. So, besides that is the comfort room. Lastly is the distant learning area. aims to enhance the accessibility of the training provision outside the main institution. Alright, so please note of this area so that you will not be lost in this facility. Alright, okay, so now let's proceed. So the training delivery is competency-based training. So why competence, or actually competency-based training is an approach that focuses on the competency development of the learner as a result of the training. So why the competency-based approach? Education and training must keep pace with technology and customer requirements. All right. So we have here 10 principles of competency-based training. Let's start off with the training is based on curriculum developed from the competency standards. So the entire training is built directly from defined industry standards that outline the specific skills and knowledge required for a job role. Second, learning competency based on or modular in structure. So the training content is broken down into small distinct modules or units of competency, allowing learners to focus on mastering one specific skill at a time. Third, training delivery is individualized and self-paced. So learners can progress through the material and complete tasks at their own speed. Fourth, training is based on work that must be performed. Fifth, training materials are directly related to the competency standards and curriculum. All textbooks, handout tools, and resources used must be relevant and necessary for achieving the specific competencies outlined in the standard. So, six, assessment of the learners is based on the collection of evidence of work performance based on industry or organization required standards. Seven, training is based on and of the job components. Eight, the system allows recognition of prior learning. Individuals who already possesses the required skills and knowledge from work, experience, or informal learning can have this formally assessed and credited. Ninth, the system allows for learner to enter and exit programs at different times and level and to receive an award for competencies attained at any point. 10. Approved training programs are nationally accredited. Alright, there you go. So, this is how the CBT process flow. Alright, first is the trainee enters program through orientation, role of trainer. So for the orientation, the trainee is familiarized with the training center, facilities, rules, and the CBT system. Role of the trainer and trainee, later I will inform you about this context. Then identify training needs. So there will be pre-assessment or interview conducted to determine what competencies of trainee already possesses. Then, organize learning activities. Next, trainee selects competency and received instruction. So the trainee formally begins the learning process for specific skill set. So administer learning agreement. So the trainee and trainer agree on the scope, duration, and expected outcomes of the training. Introduce the CBLM materials. Then, use of achievement progress report. A mechanism is established to track the trainee's progress throughout the program. So here is the CBLM learning process. So this is the core self-paced learning phase where the trainee acquires the knowledge and skills needed for the competency. So we do have here read and review, learning package, view multimedia materials, use manuals, observe demonstration, practice skills in workshop, and receive assistance and feedback. Next to that is the after practicing, the trainee is ready for formal evaluation. So, the trainer observes the performance of the trainee, and then the trainer rates the performance. So, the trainee attempts task. The trainee performs the task or competency without assistance as of on the job. Then the trainee rates his or her own performance. This is a crucial self-reflection step. So next, the performance outcome and further assessment. So the trainee's performance is judged against the required standard. So there will be satisfactorily performed competency, that diamond-shaped decision point. So that would be a yes or a no response. Then, if the trainee successfully receive a satisfactorily evaluation, then he or she will undergo the institutional assessment and then uh, exits the program. Once, actually after institutional assessment, rather, if he passed the institutional assessment, he will now undergo the national assessment, and once completed, he will exit the program. Okay, so now, as your trainer, I am your facilitator. I will guide you throughout the learning process, and I will give you all the resources I do have prepared. Then I am your mentor. I am also managers of learning, your counselor. So um, offers emotional support and addresses learning anxieties. I am also your evaluator, learner's assistant, module planner, role model. So I will demonstrate professional work ethic and attitude. And lastly, actor. So your role as trainees, you may select what they want to learn and when they want to learn it. So next is learn at their own rate within program guidelines, may request to receive credit for what they know already, may choose how they want to learn, and are responsible for what they learn and when they learn it. Okay? So now we will proceed with the competency-based learning material or CBLM package. So to dig deeper, it is simply a well-designed and carefully developed learning materials that gives trainees detailed instruction to guide them through the learning progress. So um, media that contain information related to work requirement, learning that is guided toward achieving the competency required in the workplace. So what are the different forms of learning materials? So this CBLM provide learning guides, assessment materials, workbook with activities, tasks, and content, background reading, materials or documents, handouts, and other audiovisual materials, industry competency standard, and organizational policies, procedures, and legislation. Okay? So, competency-based learning materials provide these sets of sheets. We do have information sheet. Okay? So, information sheet defines the necessary knowledge and concepts. Then, self-check allows the trainee to test their theoretical understanding. So, you will be doing task. We do have 3 sets of tasks to start off, which is the operation sheet, then job sheet and task sheet. So, the operation sheet details the step for single specific action or procedure. Job sheet naman gives step-by-step instruction for performing a skill set. And then the performance criteria checklist lists that exact standard used by the assessor to evaluate final skills. Okay? Alright, so now the two outcomes of the competency-based training evaluation system are assessed in adjectival method and not in numerical. We do have competent and not yet competent. So, these are the qualification under caregiving NC2. For basic competencies, 4. For content, common competencies, 4 competencies under that. And for core competencies, we do have 11 core competencies under caregiving and C2. Okay, so you will be evaluated according to your attitude, skills, and knowledge. All right, so now we do have here the result of the pre-assessment. Okay, so as we can see, trainee number 1 has a prior knowledge on caregiving. So I will be asking for certain proof, certification, or evidence regarding caregiving NC2. Then the trainee number 2, the result is no prior knowledge. So for tomorrow, we will begin our training for caregiving NC2. So see you tomorrow. Okay, so welcome to day 2 of the training program. Welcome to Be Still and Know Training Solutions here in Rodriguez, Rizal. Welcome to our second day of training for caregiving and C2. So before anything else, I'd like to check first those who are present today. As I call your name, please raise your right hand. So trainee number 1, Maria Corazon. Trainee number 2, Jose Marie. Okay, thank you. So now, we do have here the training activity matrix. For training number 1, I will be asking you to read information sheet 1.1-1 and then have a self-check by comparing your answers to the answer sheet. And then after that, do the information sheet 1.1-2. So please proceed to the contextual learning area. For trainee number 2, since you already have prior knowledge and skills, so you will be taking information sheet 8.2-1 and then compare yourself. You will do the self-check and compare it to the answer sheet. Okay, so we will be proceeding to the practical work area. So for trainee number 2, so the module title is Respond to Emergency. Again, I am your trainer, Catherine May P. Deliege. So for your competency, that would be on Respond to Emergency. Again, you will be evaluated according to your attitude, skills, and knowledge. So for the core competency number 8, we will be discussing the content number 2, which is to identify and explain appropriate first aid and basic emergency procedure, and will focus on first aid and basic life support application and implementation. Okay, so for today, we will be focusing on the second learning outcome, as what I've said earlier. So we will start off with reading the information sheet 8.2-1, then answer self-check 8.2-1 by comparing your answers to the answer sheet. I will be giving you 15 minutes to do that. Okay? Done? So did you understand the lesson? Not much. Okay. Do not worry. So to aid you in understanding the LO number 8.2-4, I will be showing you a video about first aid and basic life support application and implementation. Please watch the video attentively.
Emergencies can happen anywhere, so it is important to know how to provide basic life support care. As you approach the scene of an emergency event, check your surroundings to ensure that they are safe, and only kneel beside the victim after that. Tap the victim's shoulder and shout, "Are you okay?" If the victim is unresponsive and you are alone, call for help and check for breathing. Open the victim's airway. Use the head tilt and chin lift technique. Press down on the forehead with one hand while pulling up on the chin with the other hand. Gently tilt the head back. When checking for breathing, listen for sounds of breathing, feel for exhalation on your cheek, and look to see if the victim's chest is rising and falling. This is the look, listen, and feel approach. Checking for breathing should take no more than 10 seconds. Breathing is considered normal if the victim takes at least 2 normal breaths within 10 seconds. If the victim is not breathing and there is another rescuer, ask him or her to call an ambulance. If you're alone, call one yourself. The emergency medical dispatcher will give you instructions on how to provide cardiopulmonary resuscitation. Place the victim in a supine or face-up position on a firm, flat surface. Kneel at the victim's side. Place one hand on top of the other and interlace your fingers. Place the heel of your hand in the center of the victim's chest on the lower half of the breastbone. Position your shoulders directly over your hands. Keep your arms straight and lock your elbows. Compress the chest 30 times to a depth of 5 to 6 centimeters. Then, allow for full chest recoil. Chest compressions should be steady and fast, performed at a rate of twice a second. You can even count if it helps. "30 chest compressions are followed by 2 ventilations. To deliver ventilations, tilt the victim's head back and pinch the nose shut. Take a normal breath and blow into the victim's mouth. Watch for the chest to return to its normal position while taking another breath. Repeat this sequence. Minimize interruptions in chest compressions to last no more than 5 seconds. Alternate the 30 chest compressions and the 2 ventilations until help arrives. If you have another rescuer with you, switch positions every 2 to 3 minutes, because providing CPR is tiring and you can become less effective. When you see signs of the victim regaining consciousness, such as breathing, coughing, or moving purposefully, stop CPR and put the victim in a recovery position.
Okay, so now we will be moving on with, next I will be demonstrating. So now let's do the lecture regarding with the CPR. So to achieve these goals, follow these core principles. Safety first. Before you think about approaching a victim, you must ensure the scene is safe for both of you and them. A rescuer who becomes a victim is no help to anyone. Look for hazards, so scan the area for potential dangers. Next, if the scene is unsafe, do not enter. Instead, call emergency services immediately for safe distance and direct them to the scene. So, next is the general steps for all ages. So, it includes adult, child, and infant. Check the scene safety first. So, before you approach, ensure that the area is safe for both of you and the person in need. Ensure personal personal protection, BSI or PPE. So before making contact with the person, if you have access to them, put on your personal protective equipment. So this protects you from coming into contact with blood or other body fluids. Third, identify yourself and ask for consent. If the person is responsive, you should say something like, I am a certified medical responder, can I help? This establishes your credentials and gain consent to provide care. If the person is unresponsive, consent is implied. Okay? So check for responsiveness. So gently tap the person and shout, "Are you okay?" If they are unresponsive, not breathing or only gasping, proceed with the next step. Call for help. Shout for a bystander to call 911 or local emergency. So if you are alone, put your phone on speaker and call for help before beginning CPR. Position the person Lay the person on their back on a flat, firm surface. So next, check for airway, breathing, and circulation. Check for breathing and pulse for no more than 10 seconds. Okay, so for adult, check the carotid pulse. Check on the side of the neck. Use head tilt, chin lift, maneuver. Okay, so for chest compressions, this is the step that we are going to do. Kneel beside the person's chest. Place the heel of one hand on the center of the chest and on the lower half of the breastbone. Breastbone. Place your other hand on top of the first and interlock your fingers. Position your shoulder directly above your hands, keeping your arms straight. Push hard and fast, compressing the chest about 2 to 2.4 inches or 5 to 6 centimeters deep. Compress at the rate of 100 to 100 compressions so you can follow the rhythm of the song Staying Alive is a good guide. Allow the chest to fully recoil after each compression. Next is the rescue breaths. For adult, use the head tilt chin lift maneuver. After 30 compression, open the airway by performing the head tilt chin lift maneuver. Place one hand on the person's forehead and two fingers on your other hand. Place their chin gently tilting their head back. Next, pinch the person's nose closed. Take a normal breath and place your mouth over the person's, creating a tight seal. Give one rescue breath lasting about 1 second and watch for their chest rise. If the chest rises, give a second breath. If it doesn't, reposition the head and try again. Continue 5 cycles of 30 compressions and 2 breaths. So after performing the rescue breaths, we will now proceed with recovery position. Check for normal breathing and pulse. So after CPR, if the patient is breathing normally and has a pulse, proceed to recovery position. If not, continue with CPR. Alright, so next, place the patient in a recovery position. So this is the step. Kneel beside the patient and straighten both legs. Take the patient's arm away from you and place it in the right angle. Bring the other arm across their chest, holding the back of their hand against the cheek. Use your other hand, grab the far knee and pull it up so their foot is flat. Gently roll the patient onto their side-lying position on a bent knee. Adjust the top leg to stabilize the position and tilt their head back to keep the airway open. Monitor them for breathing and responsiveness. Check for vomit and any other secretion. Check the body from head to toe. Follow the cup BTLS. If they are in this position for over 30 minutes, roll them to the other side. Next is perform secondary assessment that includes vital sign, sample, which is sign and symptoms, allergies, medication, pertinent past medical history, last oral intake, and events leading up to the incident. OPQRST, onset, provocation, palliation, quality, region, radiation, severity, and time of their symptoms. Lastly, transport the patient to definitive care. Okay, so after this discussion, we will proceed. I will be demonstrating the course, which is the cardiopulmonary resuscitation for adult. Okay, so please do bear with me. This is, please listen attentively. All right, so I will start it now. So first thing to do is to check for scene size up. We will check for our environment for 360 degrees, looking for any hazard or dangerous things that could rise up in the event. So the scene is safe. I am Catherine Deliegue, first responder. Can I help? Yes. So ma'am, what happened to the patient? Okay. So now, I will check for responsiveness. Hey, sir, are you okay? Hey, sir, are you okay? Hey, sir, are you okay? The victim is unresponsive. Girl with the white shirt, please activate EMS with AED as I assess the victim. So now we will check for the airway. We will do the maximum head tilt chin lift. The mouth and nose are clear, no obstruction seen. Once done, we will check for breathing and circulation. For me to do that, I need to open the close of the patient to check for any bleeding. So now, breathing and circulation. For breathing, we will check for the pulse on the carotid, and we will use the look, listen, and feel method. So we will look for the rise and fall of the chest, listen to the breathing of the patient, and then feel for the pulse, carotid pulse for this method. Maximum head tilt, chin lift. Place your finger on the carotid pulse, then listen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So negative pulse, negative breathing. Girl with the white shirt, please follow up the EMS and AED as I do CPR. So now, in doing the CPR, we will do 30 compression and 2 ventilation. We'll be teaching you on how to use a pocket mask or one-way valve mask. We are using this to protect us, first aid responder, from any infectious disease. So now, open it, then pop it like pop the dome. There you go, pop it out. Then, as you can see, we do have here a triangular side and a flat side. So the triangular sides will be placed on the bridge of the nose of the patient, and the base part will be placed in between the lips and the chin. So I'll be placing it on the bridge of the nose and then hold it out in between the lips and the chin. So in holding the one-way valve, we will use the C and E technique. So C, you grab it out, C, and place it E on the side. Then support the chin with maximum head tilt chin lift. Then make sure to check for the rise and fall of the chest. We will provide 2 ventilation. So for CPR, 30 compression and then 2 ventilation. Maximum head tilt, chin lift, C and E technique. Ventilate. There you go. So that is how we are using the one-way valve or pocket mask. Now we will be doing compression in CPR. We will always remember that the hand placement during CPR is crucial. We will first open the close of the patient just to check any form of bleeding. Now, for us to do compression, just remember center of the chest in line with the nipples. For compression, it should be 2 inches but not more than 2.4 inches. Our whole body weight should be used, not just the weight of the arms. Now, we will be obliged to give 30 compression and 2 ventilation. We're aiming for 100 to 120 compression per minute. So, let's start with the compression. The dominant hand should be in front. Then 30 compression, 2 ventilation, 5 cycles. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 4. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 5. So after providing 5 cycles of 30 compression and 2 ventilation, we will now check the airway breathing circulation of the patient. LLF method, look, listen and feel, maximum head tilt. Carotid pulse, look at the chest area. Count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, there is a 2 result for this case. So, 1, if the patient do have a positive pulse, however, negative breathing, we will follow up with the EMS and continue with the rescue breathing. However, the second case, if the patient don't have a pulse nor breathing, so we will continue again doing the CPR. On my case, I identified that the patient do have a pulse already. However, he doesn't have breathing. So now, in that case, still I will follow up with the EMS. So positive pulse, negative breathing. Girl with the white shirt, please follow up EMS as I do rescue breathing. Now, for adult, in providing rescue breathing, we will provide maximum head tilt, chin lift, and then 24 breath per 2 minutes. So in doing so, maximum head tilt, chin lift, C&E method, breath, 1, 1002, 1003, 1001. 1, 1002, 1003, 1002. 1, 1002, 1003, 1003. 1, 1002, 1003, 1004. 1, 1002, 1003, 1005. 1, 1002, 1003, 1006. 1, 1002, 1003, 1007. 1, 1002, 1003, 1008. 1, 1002, 1003, 1009. 1, 1002, 1003, 1010. 1, 1002, 1003, 1011. 1, 1002, 1003, 1012. 1, 1002, 1003, 1013. 1, 1002, 1003, 1014. 1, 1002, 1003, 1015. 1, 1002, 1003, 1016. 1, 1002, 1003, 1017. 1, 1002, 1003, 1018. 1, 1002, 1003, 1019. 1, 1002, 1003, 1020. 1, 1002, 1003, 1021. 1, 1002, 1003, 1022. 1, 1002, 1003, 1023. 1, 1002, 1003, 1024. So now we will check for the airway breathing circulation, LLF, maximum head tilt, chin lift, carotid pulse, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So upon checking, the patient do have a pulse and also have breathing. Now, and the patient do have a positive pulse, positive breathing, we still follow up with the EMS so that there will be no complication later on. So now in doing recovery position, after CPR, we will place the patient on a recovery position. For adult, I'll be placing him. First, let's move the left arm upward here. And then on the right arm, we will place it underneath his or her face. Okay, so supposedly like this. And then the right leg will be bent upward, and then slowly we will place the patient on a side-lying position. So let's say that the leg already bent up, then place the patient on a side-lying position. So now, sir, I'll be placing you on a side-lying position. Please bear with me. In a count of 3, we will do so. Okay? 1, 2, 3, side-lying position. So the arms will be here, or the palm will be here, and then the arms will be supporting the head area. So for the leg, make sure that it is right angle away from you. So we are placing the patient away from us or facing away from us so that the vomit or any secretion won't um, intend to place with us. So now, after CPR, sometimes or most of the time, patient do vomit or secrete liquids. So, sideline position will prevent patient on having choking. So now, we will do the no blood, no decap TLS. So, no blood, then circular motion, we will check. No blood, no decap TLS. Decap TLS means no deformity, contusion, abrasion, puncture, burn, tenderness, laceration, and swelling. So those are the things we need to check on our patient. So for the head area, let's check. So no blood, no decapitated neck area, no blood, no decapitated shoulder. If it's intact, shoulder in, then check. Then circular motion to check if the back area is still intact. So no blood, no decapitated lower back, no blood, no decapitated until we go forward with the lower extremity or the lower leg area. So after 5 minutes to 10 minutes, we will now place the patient on a supine position. So, sir, please bear with me. We will now do the supine position, okay? So, in a count of 3, 1, 2, 3, go. So, now, after placing the patient on a supine position, I will be alert on checking if the patient is still stable, and I will follow up with the emergency medical services and the ambulance. So while waiting for the ambulance, I will be attending to my patient's vital sign and ask for sample in OPQRST. So vital sign is necessary for me to identify if the patient is having a good oxygenation or in a stable state. So by vital sign that includes blood pressure, temperature, if he or she is cold, then pulse rate, heart rate, then the respiratory rate, if he or she's feeling any pain. So now after getting all the information for vital sign, I will go all talk to my patient and ask for sample, which is the sign and symptoms, A for allergy, M for medication, P for past um, medical history, E for the event leading to this illness or injury. So I will jot down all those information. Then I can add up with the OPQRST, which is onset. I can ask the patient when these symptoms start. P, which is the provocation or palliation. When do this symptom provoke? So now, OPQ, the quality. Do you have pain like burning? What kind of pain? Is it burning pain? What kind of pain he or she is feeling? Now, OPQR for the region. So, where specifically does the symptom occur? OPQR. S naman is for severity. I will ask the patient on how painful he is feeling on a scale of 0 to 10. 10 is the highest. What range his feeling could be. Now, QRST for the time. Time, how long does the symptom persist? Okay? So, when I do have those information, I can jot it down on a medical sheet, and then I can relay it to the medical team once they come in. I will continue to check for my patient for every 5 minutes since this is a cardiovascular illness concern. So that would be my CPR instruction demonstration on this process. Thank you. Okay, so now after playing this demonstration, I will be instructing you to do the task, perform cardiopulmonary resuscitation for adult. Okay, so good luck. Okay, so done. So your performance of the adult CPR sequence was highly accurate and effective. you correctly perform all critical steps from checking the scene safety and activating the emergency response. So you also maintain a consistent compression. However, your rescue breath was quite ineffective because there are leaks or observable leaks. So this demonstration confirms that you have achieved mastery of this competency. I will now consider you for institutional assessment tomorrow. So again, congratulations and be ready for institutional assessment tomorrow morning. Okay, so welcome to day 3. A pleasant day to each and everyone. Welcome to Be Still Training Solution here in Rodriguez Rizal, your training center. So today is your day 3 of training program as scheduled for today. So training number 1 will be focusing on information sheet 2.1-1, which is the standard operating procedures for first aid and basic emergency procedures, and information 2.2-1, organizational standards, policies, and procedures. For training number 2, you are scheduled for institutional assessment for first aid and basic life support application and implementation, focusing on cardiopulmonary resuscitation for adult. So training number 2, you are ready for the institutional assessment. All right, so training number 2, before we proceed, institutional assessment will be having 3 hours of demonstration with oral questioning. You will be given specific instruction for the said demonstration, and then we will have a 1-hour written examination. We will start off with written exam. So here is the post test. Please answer it for 1 hour. Done? Okay. So now here is the specific instruction for your demonstration. You will be demonstrating CPR for adult and be able to finish it within 3 hours. Please start. Done? Okay. So now I have here the result of your written exam. You answered 85% right. That is a passing grade. With the demonstration, you performed well with CPR for adult. Your rescue breathing was also efficient, but take note for observable leaks. Now we will have oral questioning. Ready? Okay. So question number 1, according to the provided text, which of the following is the key reason why basic life support is needed, particularly outside of the hospital setting? Okay. Number 2, a lone rescuer come across an unresponsive adult who appears to have drowned. Based on the exception to the phone fast rule, what is the rescuer's first priority? Okay. All right, so now we'll be down to feedback. Your performance of the adult CPR sequence was highly accurate and effective. You correctly perform all critical steps from checking the scene safety and activating the EMS. And also maintaining a consistent compression of 100 to 120 per minute. So your rescue breath was also efficient, but take note of observable leaks. And for your oral questioning, you answered it correctly. These evidences confirms that you have achieved mastery of the core competency, responding to emergencies. Since this is your last core competency rather, you will be finishing up the whole caregiving NC2 course, Miss Maria C. Santos. So, um, I will check this course under your name. So I will check responding to emergency. Okay. And then, so now I will endorse you to undergo national assessment. Congratulations. So please do well in your national assessment. Before you leave, kindly fill out the training session evaluation and fill out it for the improvement of your trainer, me, myself, training of the facilities, training resources, training staff, and administration of this school. So once again, congratulations.